Good morning. It's Friday, March 27, 2015, and it's this week's installment of IARF Weekend Session. Busy week. I feel like I say that every week, but I really mean it this time. This past week was the deadline for legislators to get their bills out of committee and chamber of origin, which meant lots of committee work all week, and so much got done that both chambers went ahead and decided to cancel today's session, so we're all pretty much excited about that. A few bills of note that I wanted to cover that are on our priority list that cleared committees and are considered alive for the remainder of session. One is House Bill 205, which is being carried by Leader Sarah Feigenholtz over in the House. What's important about this bill is this addresses a couple of items that have placed some significant pressures on our community mental health providers over the last several years. The two items that this bill would address would eliminate the income verification requirement placed on CMHCs, which have required them to spend on average about 1,200 hours a year at the cost of a full-time equivalent to do income verification for individuals that walk through their doors. We clearly think this is something the division should be able to obtain on its own, perhaps even working with HFS, so that is one item that would be addressed in that bill. The second item would be to expand the definition of mental health professional under Rule 132 to expand the workforce that our community mental health centers could access in order to hire and train for mental health professionals. Heard from a lot of you over the years, particularly with the advent of managed care, where you're now in competition with other healthcare entities, including managed care companies, to hire staff. And we all know the situation with rates and reimbursements have not made it easier, so we're certainly hoping that this could address it with this bill and at least initiate or kickstart the Departments of Healthcare and Family Services and DHS to have some dialogue with us on the issues addressed in that bill. So that moved out of committee, on to second reading over in the House. Other item is House Bill 235, which is a bill brought forward by Representative Laura Fine that essentially tried to improve access to dental health care for children with developmental disabilities and the use of anesthesia in dental offices and elsewhere. A number of organizations, I know at least 18 member agencies of ours, slipped in support of that bill in committee yesterday. Dozens of co-sponsors in the House came out unanimously. Surprise, surprise, the insurance companies still don't like the bill, but there is some belief and some hope that the Dental Society, the insurance companies, and the representative could work through a positive resolution of their concerns. Another bill that's on second reading. Third bill we want to talk about is Senate Bill 1383, which is freshman Senator Scott Bennett's bill that would establish ABLE Act accounts here in the state of Illinois. This is an initiative of Treasurer Frerich's office, and those of you that attended our IARF meeting in the membership this week knew that Chase, with the policy director, Chase with Treasurer Frerich's office, came to talk to us about that bill and its importance, and was very thankful of the feedback that they got from IARF members during the meeting of the membership. So we are very thankful for members that slipped in support of that bill. We think it's going to be a good outcome for families and individuals with developmental disabilities, and we hope to help shepherd that bill through the process this year. Finally, and most significantly, action was finally taken this week to resolve the FY15 budget situation, and a supplemental package did clear the General Assembly by clearing the Senate yesterday and has been signed by the governor. The important thing is that supplemental, as many of you know, prevented any sort of Medicaid fee-for-service rate cuts to community DD and mental health providers. The asterisk being that our Medicaid managed care companies did get a rate reduction, and we're currently trying to work with those providers, rather those organizations and HFS, to ascertain how that's going to be, how it's going to impact community services. But certainly Medicaid fee-for-service from the mental health and DD side was not impacted. There was included an ICFDD rate cut that we were able to work with legislators and staff to get removed before final passage. It should be also noted that there was a significant amount of investment made in community DD, mental health, and EI lines in order to prevent those lines from running out of money before the end of the year, which was very good. We did see some haircut in some of the mental health lines, and I believe the early intervention line will receive about a 2.25% appropriate reduction. But given where we started, which is millions and millions of dollars in the red for the FY15, I think that this is an example of compromise being the path to victory, as we were able to work to get most, but not all, but significantly most restorations in the FY15 budget in order to pay out liabilities for the rest of the year. So as the legislature goes off to spring break and they come back, we can now fully focus all of our efforts on trying to get to a different outcome on the fiscal 16 budget than was proposed by Governor Rauner. We've been laying the groundwork for those activities as we did on the FY15 supplemental. Many of you are doing some great work back in your districts. We're excited to hear from members that are organizing roundtables, having legislators come out to their facilities to visit individuals and families. And if you've not already reached out to your legislators and tried to schedule some roundtables, worked with your other member and non-member providers in your area and your regions, we encourage you to do so to try to gin up those activities. Look for some additional advocacy directions to come from Cyrus later this week. We're going to wrap up by saying we won't have any special random person from the State House for the next 2 weeks due to the legislative spring break. We are super excited that we were able to sit down for a little bit with Senator Pamela Altoff, a Republican from McHenry County, to talk about an issue that she's advancing as well as her vote on the FY15 supplemental, and have some discussion about some prospects for the FY16 budget moving forward. I'm going to go ahead and bring you that segment now, and super excited also to say that next week will be the triumphant return of Thoughts and Considerations with Cyrus Winnet. Bye for now. For this week's IARF Week in Session, we're super excited to be sitting here with Senator Pamela Altoff.
Super excited.
Super excited from up in McHenry County. So thank you for agreeing to talk with us this week.
Absolutely.
So there are a couple of things I wanted to talk to you about. One is I wanted to ask you about legislation that you, or an issue rather, you've been working on for at least a couple of years now, and I know you've introduced another bill this session, Senate Bill 850, which is the custody relinquishment bill. Correct?
Correct.
Just wanted to give you the opportunity to kind of talk a little bit about what you've done previously and what you hope to do with that bill.
Well, this is a collaboration. Representative Sarah Feigenholz over in the House, who is a Democrat, and I have been working on this issue together for quite some time. The idea behind this is in Illinois, we have this antiquated system where if you have a child who is suffering from some type of a psychosis or a mental illness, and you really no longer feel that your home is a safe haven, and you want to find assistance for this child, help. You have to run through all of your personal private insurance, all of your assets to retain your parental responsibility for that child, or you can give up all of those rights and make the state of Illinois the guardian of your child. Most parents don't want to do that. They would like to keep their family intact. And so what this legislation attempts to do is to provide a pathway, a cost-effective pathway to keep families together and still provide those services that are absolutely crucial for those children.
Are there any major roadblocks you see to the movement of the legislation that you want to talk about? Or?
Originally the major roadblock was the fact we were in the midst of an election, and we didn't know who was still going to be in charge of the agency, so there was a huge amount of time that passed while we just grappled with what the next step was going to be, what the future held for the administration in the state of Illinois. We now have a new administration that's very supportive of the initiative. We're working very collaboratively, as you know, with Heather O'Donnell from Thresholds. Thresholds has been an organization and a provider in my district that I've had a long-term relationship with, very close and positive. So we've been trying to, again, address the issue and come up with a solution. The biggest problem now, once we have the three agencies that are involved in this, which is DCFS, DHS, and HFS, now we have a collaboration. There's actually an intergovernmental agreement that's been created. The legal entities, the chief legal staff of both HFS and DCFS, no, it's HFS and DHS are now reviewing that document. We think we're going to move forward. So now the biggest stumbling block is what the state of Illinois grapples with all the time, which is money. Both Representative Feigenholz and I feel that there was a $7 million allocation in this year's budget for that program as a pilot program to see if we couldn't get all of those parameters and the processes put into place and then test it out. Now again, with what just happened today and with that $1.6 billion hole that we just plugged, we're still trying to determine whether or not there's $7 million, $5 million, how much money is still available to make sure that this program goes forward as a pilot program. We ran into a little bit of difficulty in trying to figure out which agency should be the lead agency. We've now decided who it is, and it's a collaboration, and I think we can move forward as long as the money is there.
Well, it's very encouraging. As I hope you know, IARF is supportive of that legislation, and we hope to do what we can, and certainly maybe additional mental health providers around the state can be helpful as well to see this important initiative move forward.
And what it's done, again, with this new administration is it's allowed us the opportunity to meet with all of the new agency directors and explain to them this kind of historic process that we've been going through and work together to ensure that now that we've done all of the collaboration, that we move forward. And one of those initiatives will also lead to a children's cabinet that can start to really look at all of these issues from kind of an umbrella perspective and make sure that we are going forward and we are doing all of the right things and that we are not as antiquated as we've been for the last 25 years and we moved into the 21st century. So, you know, opportunity exists. We remain hopeful. We do have the support of most of our agencies' directors. Again, the stumbling block will be how much money can we allocate to this program.
Well, right on. And you mentioned money, which we get into budget then with that situation, and the Senate just actually not that long ago took action on an FY15 supplemental package, one that from our estimation and our view was a good compromise with respect to protecting community developmental disability and mental health services. I know you voted yes on that package. Did you want to talk for a couple minutes about what the motivating factors were for you in that vote?
Well, what the motivating factors were was that government was going to halt in many areas if we didn't resolve the $1.6 billion shortfall. We had child care providers that weren't receiving monies. We have court reporters that were all going to be put basically on furlough. We have Department of Correction individuals who weren't going to get their checks at the end of the week. All of those things drive you to making sure that those individuals aren't harmed any further. What I liked about this is I think that the negotiations between the governor, the speaker, the Senate president, and the two Republican leaders really set the foundation for us moving forward. Education was taken care of. Most of the school districts, even if they have a significant shortfall, have a pool of money that they can go to so that they stay whole financially. As you may mention, developmental disabilities and some of the other human service areas were funded. I think that bodes well for moving forward in 2016. I think this governor is showing that he is a compassionate yet practical leader. I love that about him. He does not want to harm our vulnerable populations, but he certainly understands that decisions made over the past 10 years and some of the fiscal mismanagement, regardless of who's to blame, need to be resolved as we move forward so that we can constantly ensure in years to come that we're not grappling with a budget that doesn't fund all the services that we are supposed to provide for our constituency. So I'm very encouraged.
Well, and we're very thankful for your vote. Again, as I may have indicated, that the situation could have been much worse by the end of this month for community and mental health services. We're very thankful for your support. And knowing, or at least my personal belief, that compromise is always the key to victory. And you do mention the FY16. Given how this played out over the last couple of weeks in terms of leaders working together on a compromise solution, is this a good preview into what we can expect for FY16? Because the governor's proposed budget, while attempting to preserve core and essential services, did include a number of cuts to community and mental health services.
And I think it's a beginning conversation. As you saw with this particular solution and fix, what was originally proposed is not what we ended up with. It's kind of a compromise, as you alluded to, and it is a step in the right direction. I think it bodes well. I really do. I think that it ensures that you have a seat at the table to talk about what happens if all of the services sustain huge cuts. I think the governor listens. I also think that the speaker and President Cullerton understand what their caucuses need and what they want to ensure still is funded fully. I think there's compromise all the way down the pathway, and again, I'm very, very encouraged for it next year. And I'm going to remind you, you always know that you can count on me being an advocate. My background is in developmental disabilities. Not only did I teach, I served on numerous not-for-profit boards that deal with that, so I am a strong advocate to ensure that those individuals continue to receive the services that they need.
Great, thank you. And just a last shout out perhaps to the service providers back home.
Oh, there's too many to name. I mean, we have Pioneer Center, we have Thresholds, we have our Suicide Task Force, we have numerous providers that are always there for us. So the shout out is to all of them to continue to advocate, to continue to be a resource to me. I mean, that's the best part, is that I've been around, I don't want to tell you how long I've been around. I've been around a long time, and I think that most of my service providers know that they have my ear and that I'm always available to them. So I thank them for that.
Wonderful. Thank you, Senator. We appreciate
Thank
the
you.
time.